If you've watched our show a lot, you know that Dr. Fleming is our medical expert and a board-certified geriatrician. He's also helped establish Florida Hospital's Geriatric Assessment Center. Welcome, Dr. Fleming. So let's go ahead. We're going to start talking about deprescribing medications, polypharmacy. What is polypharmacy?
First, that's one of my favorite topics. Polypharmacy literally is many medications or many drugs. Okay. The definition varies upon the situation. In nursing homes, the government's definition is 9 or more medications, which seems like a lot. But when you have 5 chronic conditions, it adds up quickly. Most physicians say 4 or more prescription drugs is plenty. And any drug that doesn't have a compelling reason, that doesn't have a diagnosis to fit the use of the drug.
On average, how many drugs are seniors taking?
Well, you know, the senior population is a very heterogeneous group. There are the young old that are out playing tennis who take nothing at all. And then there are the bedridden Alzheimer's who may take 20 drugs, believe it or not, which is sort of ludicrous. And everything in between. Probably the average is 1 to 5 for seniors. And
I know, I mean, many of these medications are necessary, but what is your concern as they start getting up into some of these numbers in terms of if they're really necessary or not?
Sure. You know, modern medicines are very potent, and they can have significant adverse effects on internal body organs. But in the elderly, what we're more concerned about is contributing to the risk for mental decline and falling. Those are 2 huge issues. So any drug that affects mentation, the psychotropic so-called tranquilizers, sleeping pills, painkillers, can impact one's cognition. And again, things that affect blood pressure or things that affect body fluid status can lead to a fall risk. And a fall goes to the top of the list in terms of a serious impact on the elderly person's life.
And I imagine a lot of people wouldn't necessarily think that there are benefits to reducing the medications that they're taking, but there actually are.
Sure. Number one, if the indication is no longer there. Over time, you may not need a particular medication, yet they continue by habit or by previous recommendation. So exactly. So what we do is scrutinize the medication list with every visit.
And how do you determine, so a patient comes in, how do you determine if you can actually reduce it or not? Is it a matter of just saying, okay, first of all, let's get the list?
More than the list, we have them bring the pill bottles. We want a bag full of actually what they're taking. We set it out on the table in front of the doctors and the caregivers, and we look at not only the medication and the dose, but who prescribed it. Are there redundancies? Are there some drugs that are both generic and brand name and they're the same thing? We see that all the time.
Are you really seeing that, where people are taking the generic and the name brand and don't realize it's the same medication?
Which is why a list isn't good enough. When we actually look at the pill bottles, we find mistakes all the time.
Wow. And how does that consult continue? So you lay them all out, you take a look at them, and I imagine folks, you know, they're very, you know, particular about the pills that they're taking. They probably don't like it when you take one away, do they?
Plus they paid for them.
Exactly.
And that hits in the pocketbook. But we use that as a reason also to deprescribe to save money. But yes, at every visit we review the medications and reassess whether or not they're still appropriate, the dose is appropriate, and the monitoring is appropriate.
And I have to imagine, though, that there are some adverse effects when someone does stop taking, obviously when stop taking a medication, even if, you know, they're taking others that maybe can compensate.
Sure, potentially anyway. So we are sensitive to the possibility of withdrawal reactions, and some medication can do that. We generally taper rather than stop abruptly, but after stopping or reducing the medicines, monitoring is critical.
And I would imagine that, you know, before you would deprescribe a medication, you would look and see, are the benefits going to outweigh the risks?
Exactly.
Okay. How important is it for folks to make sure that they work with a geriatrician or their doctor on this?
Oh, it's key. Medicine is a two-way street. It's a dialogue. And patients should have enough health literacy to understand their medication, to know what they're for, and to take them appropriately.
All right. Well, Dr. Fleming, thank you so much. Definitely very important information. And remember, if you are going to want to stop taking any medications, you need to work with your doctor directly.